We're joined by Dr. Dara Kass, Yahoo medical contributor and a associate professor of emergency medicine at Columbia University. So, doctor, I want to kind of pick up on something that Anjali just said, which was about those mask mandates. And I feel like I consistently repeat this question to every doctor that I chat with. Everyone is saying, of course, we need to wear masks, we need to wear masks, we need to wear masks. But we don't have a mask mandate as yet. I mean, I'm seeing folks that are in Congress calling masks oppressive. So I feel like we have to kind of put the whole everyone needs to wear masks to the side. I'm wondering from you that if we continue on the path that we are currently on, where we have almost 11.5 million people in the United States testing positive for coronavirus, do you think that lockdowns are going to be the only thing to keep people safe? We just heard from Dr. Celine Gounder saying, there might not be necessary, but I just keep seeing these cases surging all around the country. And I'm sure many folks like myself are feeling a little bit nervous and anxious to see these numbers.
So I think that what Dr. Gounder said, and I think what's consistently coming from the Biden administration, is that it's about leadership and data that will get us out of this pandemic. And so what I mean by that is that we need to have real numbers against why we would close certain businesses and keep others open. For example, we know that there really isn't a lot of transmission in schools. And so a lockdown across the board would only have to happen in communities that had such large viral spread that their schools would be unable to protect their students. What we need to know is, what would the positive test rate have to be? What would the number of tests per day have to be? And with the mask mandate, what's very interesting is that this is purely a leadership issue. There is no conflicting science about whether or not masks work. We know they work not just to protect the person wearing the mask from spreading the virus, but also from protecting the person wearing the mask from getting the virus, or more importantly, getting a severe form of the virus. So what we'll see with the Biden administration is a national mask recommendation at federal spaces, and then obviously the partnership, I think, with local officials to continue to reinforce mask wearing in their local jurisdictions, knowing full well that it's going to be up to the local communities to reinforce mask wearing and to really show leadership at the community level, at the school level, and at the elected official level to keep masks front and center as we get out of this pandemic with the therapeutics and the vaccines that are coming, our way.
Now, as I mentioned, we're standing right now at a daily case count of 11.4 million. And every day on this show, I share the numbers of those daily case counts. And it was under 10.6 million on Friday, less than a week ago. And we've seen a huge jump. I'm wondering, as you're seeing, looking out across the country, do you think we're going to get to a point where this virus really starts spiraling out of control? Or would you describe this as the spiral already, where we start to see these numbers? I mean, it's almost unthinkable to me that we're seeing these numbers jump 100,000 cases a day. But I kind of want to know, how bad could it really get going forward?
So honestly, we don't know. This is really unfathomable to those of us, especially those of us that were in March and April in New York City, and we were dealing with 20, 30,000 cases a day and really felt like we were at our breaking point. The idea that we have let ourselves get to the point of 100 to 200,000 new cases per day, with a death rate right now seeing between 1,000 and probably up to 2,000 deaths per day, and really not interested in doing much about it at the federal level, is astounding to those of us that are watching these cases on the ground and feeling the personal effects of this virus. I don't know what our threshold is for tolerance for suffering and death under this current administration. I do know that things will change come January 20th, because new leadership will enforce new restrictions and, more importantly, new guidance about what we need to be doing to get ourselves out of this pandemic.
So you, of course, are an associate professor of emergency medicine, and we've heard a lot of talk around hospitals, emergency rooms, of course, that they are going to be getting inundated. I have friends that are doctors that are telling me, and they work in pediatrics, that their children's hospitals are now having to take on adults because the adult hospital, those beds are becoming filled. What does a worst case scenario really look like going forward between now and, as you mentioned, January 20th, when we're going to have a new administration?
And remember, there's no light switch that happens January 20th. On January 20th, we'll see the beginnings of new leadership, which will hopefully start to take effect between 4 and 10 weeks later. But it's not going to happen overnight. Unfortunately, when we need hospital beds, we take them from where they are. And so we've seen the conversion of children's hospital floors to adult hospital patients. The worst case scenario is one where you go to the hospital for actually something unrelated to the coronavirus or the coronavirus in a critical illness, and there is no bed for you. right? You go there, you need to be intubated. Maybe you are having a heart attack or a stroke, or that's your family member. And you get there and there's no more room because the patients who get sick with this virus stay in the hospital for a very long period of time, even when they survive. It's been it's been very poor messaging from the beginning to act like just because this virus didn't kill you right away, it somehow wasn't a stress on the system or the patient. It is a devastating virus, even for those who survive. And we need to not forget that as we head into the winter and see our hospital systems get stressed.
I would be remiss if I didn't ask you about the vaccine. Roughly 95% efficacy rate across both the vaccine candidates from Pfizer and also Moderna. Wondering if you can share some thoughts, if you are enthusiastic, optimistic looking forward, or do you have some questions even in the back of your own mind, since that data has not really been released yet in a peer-reviewed journal? It's just coming out to us in press releases right now. And of course, there's a lot of concerns and questions about what the rollout is going to look like.
So I think that we've all learned now that press releases are not peer-reviewed data and that we need the data to really understand what those numbers mean. But those numbers are encouraging. And more importantly, Pfizer and Moderna and the other vaccine companies have really walked the walk. They put out a process and they're following the process. This is happening faster than any other vaccine development ever before. But part of that has to do with the investment in not just the production, but in the pre-purchasing of the virus of the vaccine doses, and also in the pandemic itself. The number of people that were exposed to the virus in phase 3 has happened at an extraordinarily fast rate. I am very encouraged by this data. I think that it's a new vaccine process. Seems to be a really good fit for this particular virus. And I think that we're going to see encouraging data with a great safety and efficacy profile. The delivery is going to be complicated. Obviously, both of these vaccines need cold storage and are harder to distribute than a regular room temperature vaccine. But I am encouraged by this information. And I think it means that there may be a light at the end of the tunnel for all of us. And we just need to stay the course through the rest of the winter.
All right, Dr. Dara Kass, Yahoo Medical contributor. Always great to chat with you. Thank you so much for breaking all of that down.